Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Welcome to Friday Friends. It's so good to see you again, virtually at least. I am Deb Burton, the founder and creator of RI Elder Info and RIElderInfo.com. We provide the most comprehensive resources for seniors, caregivers, and professionals. And every Friday morning at 9 o'clock, I join you here on Facebook and YouTube to share information that you or someone you know really needs in order to remain independent. It's great to be here. It's great to share it with you. But what we do would not be possible as a nonprofit without the support of our sponsors. So I give a big shout out and thank you to Oak Street Health. They have locations in Warwick, 2 in Providence, and 1 in Woonsocket. They provide primary care for Medicare recipients, including transportation to the doctor's offices, which is really pretty cool because we know that that's something that a lot of folks struggle with. Also, United Healthcare. United Healthcare is one of our Medicare insurance companies here in the state. They are a wonderful program. You can reach out to Jen Barrows over there if you have any questions about your coverage. Also, Tamarisk Assisted Living. It's a great little assisted living located in Warwick, right over by the malls, easy on and off the highway. You would reach out to my friend Susan over there or Sean. They will take care of your loved one as if they were their own family. So Tamarisk Assisted Living, great little place. Also, the magic that you see happen here would not be possible without the support of D&B Media. So thank you to Ben, who's behind the scenes making this happen, and England Studio. England Studio is the organization or business, I should say, who created the actual website, RIElderInfo.com, which has won awards for ease of navigation, ease of use, ease of understanding. They really worked hard to make sure that RIElderInfo.com is accessible to everybody. So without further ado, I would like to introduce Leanne Fontaine from Seven Hills. Hi, Leanne.
Hi, how are you doing?
Good. So I know where you're from, but if you'll share with the viewers out there, what do you do and where do you do it?
So I'm Leanne Fontaine. I am an intake coordinator at Seven Hills, Rhode Island. It's a nonprofit organization serving individuals with developmental disabilities, the older populations, and also child and family services. So what I do is I do intake coordination for our 2 self-directed programs. It's under long-term care through Medicaid, and they're called the Personal Choice and Independent Provider programs.
So with those programs, I get a lot of calls from folks, particularly during COVID, it has come up even more frequently. The older adult doesn't want to go into long-term care, and their adult children are like, well, I could quit my job to care for my mom or dad or, grandma or grandpa, aunt or uncle. But, I still have my own bills to pay. So do these programs, the Personal Choice or the Independent Provider program, are they programs that would pay a family member to take care of someone?
Yes, sorry, I should have explained a little more than just self-directed. So what it really does is instead of having an agency find caretakers for you, it's an individual self-directs their Medicaid long-term care service funds. So what that means is that they can hire their own caregivers and utilize their Medicaid funding to pay those caregivers. Our independent provider program also has an option for a registry. So if individuals don't have a caregiver or someone in their life that would be willing to be a caregiver, we also have the independent provider program that opens somebody up to a registry of caregivers that are ready to work with the individual within their home.
So there's two different programs. One is the personal choice and
Yep.
one is the independent provider. What does it take for somebody to be eligible to participate in either of these, like both of these programs, or one and not the other? Um, how is one eligible to participate?
Yep. So someone has to be open to Medicaid and Medicaid long-term care. And the eligibility process with that, and there's certain income limit and asset limits. But it would be eligibility through Medicaid, and then a statement from a doctor determining a level of care, which means the individual has care needs that are up to nursing home level of care, and a doctor makes that statement. And we have a form that we do to provide to the doctor. And then that really determines their eligibility for the program.
Okay. So do you help people with the Medicaid application, or do they have to go through their local community action program, or like Tri-County CAP, East Bay CAP, West Bay CAP, Child and Family Services, or do you do that?
So we can help with that process. And also others I know help, like the CAP agencies. I know DHS assists individuals, and then even some case managers that I've met some at the VA hospital that have helped individuals, and other long-term care agencies. So we can assist with providing the Medicaid application. And then also we receive referrals from other agencies who have helped individuals with the Medicaid application.
Awesome. Now, and just to be clear, you don't provide like financial advice or anything like that, or legal advice to people when it comes to the Medicaid application. It's just sort of, here's the 42-page application and we can show you what parts you have to fill in. Is that
Correct.
it?
Correct. Yep. So we provide the tools to be eligible for the program, but really guidance really should come from DHS, because there's certain things that they require, or certain questions that I may not be able to answer as far as eligibility. So I always refer back to a DHS social worker, and or legal services if someone is more interested in that route too.
That makes perfect sense. I mean, Medicaid looks back 5 years, but there are some situations where maybe you gave money away and within the last 5 years, and they don't consider that. So sometimes Medicaid has a lot of if this, then that.
Exactly.
Government forms are always good fun. So
Yeah.
once somebody's approved for Medicaid, do they give you guys a call to say, I want this program, or does a social worker help them, or does the family member reach out? What are the next steps?
So the positive, like the pro of going through DHS and applying through DHS, is that you would get options counseling, and so you would get all the options in the state, like for long-term care, when you're applying to Medicaid long-term care. If the individual or family member calls Seven Hills directly, I really can only provide the information about the personal choice and independent provider program. I have some information about other programs in the state, but I just am not knowledgeable in that area. So usually, if someone calls and is interested in the personal choice and independent provider program, I provide them with the information for those programs. And if they need to be eligible for Medicaid, then I provide them with that Medicaid application. If someone teams up with DHS and they get the Medicaid application and long-term care application all set with them, usually DHS will do options counseling, and they will figure out what program is best suited for the individual and what the individual wants. And then from there, they make a referral to us. So it's just a little bit more streamlined if it comes from DHS, just because they've already explored other options and they know for sure that this is something that they would like.
Okay, so now the person has discovered. So, well, we'll start with, say, personal choice. What's that individual, like what's the next step? So mom has been approved for Medicaid. She wants to do personal choice. What does she need to do next?
Yeah. So once I receive the Medicaid application and or eligibility, and all the individual paperwork back for the personal choice program, I usually do a screening call. I figure out if they're eligible, and then I send that paperwork out. So that's how they get that. And then from there, once I receive it back, I can do an assessment. So what we do at Seven Hills is we do an assessment of the individual's care needs, and that's required for both programs, actually. It's the same assessment for both programs. And this really determines how much money is going to be attached to their program, which translates into an amount of hours that they can hire caregivers for.
Okay. And so for personal choice, someone is assigned X number of dollars. And under personal choice, who decides how much the caregiver gets paid?
So for personal choice, this is the big difference between the two programs. For personal choice, the individual who's receiving services and or an authorized representative who speaks on their behalf, if they would need assistance with the program, they can set the caretaker's wage anywhere between $11.50 and $15 an hour.
Okay. Okay. And for personal choice, do people need to, is it overseen by the Rhode Island Department of Health? Are they required to be vaccinated? Like the new mandate, everybody needs to be vaccinated.
As far as I know, there is no mandate for vaccination because it's in the individual's home. I'm pretty sure it's all up to the individual's preference, really.
Okay. And so, maybe, mom has, I don't know, the kids after school can help, make sure that mom gets, something to eat after school. And, it's just a matter of waiting until, I get home from work kind of thing. But on the weekends, maybe that caregiver is running around and there's soccer practice and baseball or football. And so mom is really kind of on her own. And that's when she needs to hire somebody. Can mom say, hire the neighbor next door and say, I'll pay you $15 an hour?
Yes. Yep. So the employee or the caretaker that the individual chooses, they would be required to get a background check, a national background check, and other employee forms done, like tax forms and all that.
Yep.
We work with an agency called the Fogarty Center, and they take care of all the financial piece for the caretakers. So Seven Hills, we oversee the individual and or the authorized representative, and we keep communication up with the individual. The Fogarty Center takes care of the caretakers. So the Fogarty Center will take care of any necessary CPR license or background checks and or employee forms. So when we get an approval for the assessment that we complete together, I usually send the information over to the Fogarty Center, and from there they make a spending plan, it's called. And that is when the individual and I can talk about how many hours they have, what rate they would like to pay each caretaker, how many caretakers will they have. And then from there, we can adjust it. So I don't pass that over to Fogarty Center until it's confirmed by the individual. So say they have 20 hours and they want to pay $15 an hour, it may lower the hours a little. Yep. So what we do is we talk about the rate of pay versus hours, and the client or individual makes the adjustments, and then we send that over to Fogarty Center.
So for personal choice, that person who's approved for Medicaid is allotted X amount of dollars, and then you kind of work with them to see how many hours will that buy. If you wanted to pay somebody $15 an hour, or I think you said like $12 an hour, like how do you really maximize that amount of money that is designated for you? Because It might be like you just need somebody to stay overnight.
Right.
Right. And that a lot of times costs more, but that's really what you need. So you
Or
kind
even
of
like
work
you
that
said,
out.
yeah, exactly. And even like you said, like after school, like I just need a person 2 hours every day and then majority on the weekend. So I see a lot of individuals like sometimes pay matters and then sometimes hours matter. So it really depends on the individual and the case, but they can adjust how they find is the best suited for them.
Yeah. And with personal choice, that would mean mom needs to have an idea of who is going to do the work. Like she already has someone, but
Yes.
working with Fogarty, is it that mom signs the time slip and Fogarty actually does like the payroll processing and making sure that payroll taxes get done, or does mom have to handle that?
Yeah, that's a big fear of individuals where I hear that a lot is, oh, do I have to figure out the taxes for individuals? Like, no, that's why we have the Fogarty Center. So the Fogarty Center, they take care of the financial payroll process. The individual who's receiving caretaking services, they're responsible for signing timesheets. So that's why I mentioned authorized representative as well. Because if someone is unable to do that or feels like that's too stressful and they have somebody in their life who's willing to do it as a volunteer help,
Yep.
they can always assign an authorized representative to sign timesheets as well.
Oh, that's good. So, I mean, in that way, you get to pick your caregiver in a more personalized fashion, but the whole paying them kind of piece is really kind of similar to a more traditional model when you're going through a home care agency where it's like, yeah, you have to sign a time slip, but you don't have to make yourself crazy and you still get to like get the person that you want to give you care.
Exactly.
Yeah,
Exactly. And I
that's
don't
cool.
know how if the community is familiar with like past services for children's
Mhm,
services for developmental disabilities, but it's very similar,
mhm.
where you can pick your own worker, but the agency helps fund or helps streamline the funds to the caretaker. The best way I can explain it.
Yeah. So the other program, the independent provider program, how is that different from the personal choice? Because the independent provider program, I think that came out like towards the end of 2019, just before COVID blew everything up for everybody.
Yes,
So what
exactly.
what is the independent provider program?
So the independent provider program, the biggest difference is that there's a set wage rate of pay for caretakers, and that's at 1382.
And who
Um,
decided that?
so that came as a DHS contract.
Okay.
Not really sure exactly how that was determined.
Okay, so
Um,
that's not the person who's been approved for the services. That's not the Medicaid recipient that's saying it's 1382.
right.
This is the state saying you will be paid 1382.
Exactly. Yep.
Got it.
So it's a
Okay.
set rate in policy. um, so it's 1382. And then another huge difference is we work with a different financial agency for independent provider, and
Yep.
they're called public partnerships, or PPL for short. And they also have a registry of caretakers.
Mhm.
So if an individual is unable to find somebody in their life, but they would still like to maintain a certain level of control over their caretakers and choosing caretakers, then they can also be open to this registry, where they have every right to go through the registry of caretakers who are already ready to work in homes, and they review it, they interview people, and then they choose an individual off of that registry.
Awesome. And with these programs, are you finding that they are helpful for individuals? Like, do they facilitate individuals to receive culturally appropriate care? Because I'm thinking, I have friends who are from Cape Verde and they're looking for an individual to provide care who speaks Cape Verdean and knows how to make cachupa. I know individuals from Korea, and they want to make sure that the person coming in, understands their cultural beliefs and maybe knows how to make the kimchi. Um, you know, do you know how to make arroz con pollo? do you speak Spanish, and which Spanish do you speak? So is this an opportunity for people to really get the care from culturally aware individuals? Are you finding that helpful?
100%. You said it perfectly. Like that's exactly it. It's an individual gets personalized supports that are appropriate to their needs, appropriate to their culture, their traditions, and I think that's really important to individuals, especially within an intimate setting in their home. I find a lot of individuals may say like, oh, I don't know about those caretakers that are being sent over. I really want to choose my own. I would like somebody who understands my language or my food, even my food preferences.
Yep.
And I find also too family members who are advocating for an individual for these supports will say the same thing. I go to work. I want someone who is at home with mom. Mom only wants me because I understand her culture, her language, and her customs. And I would really like to hire my friend of my friend who also is familiar with the same culture, So I think it's really, really important, especially, like I said, in an intimate setting like a home. I think it's very important.
Yeah, I can definitely see that being really, really important. So if people wanted to apply for these programs, maybe they're already on Medicaid, and they're going maybe now through the traditional home care agency, and the home care agency doesn't have staff. Like I'm hearing that a lot, particularly since the vaccine mandate. Um, if people wanted to switch from the traditional agency model to the personal choice or independent provider program, how do they do that? Do they call you?
So they can start at DHS or they can call us. We are in direct communication with DHS and EOHHS, and we provide guidance on where people are at. So if someone comes over and says, I would really like to self-direct my Medicaid supports rather than go through an agency, I I recommend them to speak with the home care agency too, because they have to close things on their end. And also have a discussion with DHS possibly if they're kind of unfamiliar which way to go. But then also I provide them with the application for personal choice or independent provider if that is decided the route that they would like to take. Because it's really like I use the word self-directed. So self-directed supports really means that it's the person's choice, and that they can choose what type of services they get. But also, if someone's under Medicaid, we can't have any gaps in types of services. So if you're on Medicaid, it's by law we have to provide services. So it's really good to keep the home care agency and DHS involved as well, so that they can continue providing those services while we're waiting to get onto a new program.
That makes sense. And for the independent provider model, well, actually, for either of the models, are the caregivers required to complete certain training?
So that is a big difference as well. For the independent provider program, there is a required orientation that PPL, the financial agency we work with, they require for caretakers to do. This is online as far as it is right now, unless that changes over time. But right now it's online orientation and a couple of other classes and trainings on caretaking. The personal choice program is different, where it's more about the individual doing most of the training. So the individual or someone on their behalf would be recommended to do their personalized training. Like, this is how I want to be showered. This is how I want my meals to be cooked, those kind of things.
Got it. And for either one of the programs, if it's not working out with their caregiver, who's the one who fires the caregiver? mean, hopefully that wouldn't happen, but things happen.
Let's hope not. But yeah, that would be actually up to the individual. So
Okay.
again, because it's a self-directed support, the individual is responsible. So they're responsible for hiring, firing, and also follow through, and to ensure that the right hours are being paid for.
That's awesome.
Yeah.
Okay. Okay. And so then the other question I'm thinking is, if I'm someone who's out there, I have extra time and it sounds like a cool thing to do. I don't want to go to, do 120 hours at, a local CNA training class. It's kind of something I want to do on a part-time basis. Like, oh yeah, I could go help somebody, on Saturday mornings. My kids are grown, and if somebody needs help, sure, and I can get paid. Where would people who are interested in being caregivers go to apply?
The best answer I have for that, because I don't know exactly like an exact resource to go to for these two programs, the best advice I have is to possibly either call DHS and or call us, because we have direct communication with DHS and PPL. And PPL has the registry of caregivers. I've gotten a couple of calls about people looking to be a caregiver at home in people's homes, and I've sent that over to PPL and DHS. So it's helpful to put your name out there if you're interested,
Yeah, absolutely. Absolutely. So if people are interested in the personal choice program, you've got a website up there.
Yep.
Ben can bring that on the screen, the Seven Hills Personal Choice. And people can learn more about it right there on your website.
Exactly. Yep.
And then there's also the independent provider model, which is also on your website too. So people can see the difference in the two. So that's good. But
Yes.
if they had questions and they're not sure whether or not, switching is appropriate or anything like that, do they call you?
Absolutely. Feel free to reach out to us. No problem. My main duty here is intake calls. So I do screenings on almost daily and assessments. So please feel free to reach out to us anytime.
Awesome. And when people call that 229-9700, do they have to press 1 for this and 5 for that and rub their head and pat their belly to reach you?
Yes. I'm sorry. There's 2 options. There's only 2, I think.
Oh, good. Okay.
So I've called it, and I think it's option 1 for personal choice or option 2 for independent provider, but either one comes to my desk.
Oh, good. Okay. So there's no wrong answer there.
No.
They will get to you, and you can answer the questions either way.
Exactly. Yes. And I also, I wanted to share the main number for Seven Hills as well.
Sure.
I forgot to mention that earlier. Sorry. But that's 401-597-6700. That's the main number for Seven Hills.
Oh, all right. So that's for other programs too.
Yep. Okay. And our receptionist will usually screen calls as well and figure out what type of services they want. So if they can't get through to the 229 number, they can call the main line and they will be directed to me.
Okay. Awesome. Now, most of the time, my viewers are interested in information for older adults and the professionals and caregivers who serve them. But you mentioned something earlier. Are these programs available for younger individuals with maybe intellectual or developmental disabilities or other disabling conditions?
Yeah, so we have other self-directed supports at Seven Hills. So for individuals with developmental disabilities, if they receive BHDDH funding, we usually recommend to do the self-directed supports through BHDDH because they're already eligible for BHDDH services, and it's a different type of funding. But also open for individuals who are younger, who do have a disability or disabling condition of some kind. And like I was saying, like the level of care from a doctor really determines the eligibility. So I've seen individuals in their 40s to 80s to 90s. So, and also individuals with intellectual disabilities, if they don't receive BHDDH services and would like to be on this type of program. So,
Wow.
yeah.
It
So, but
sounds like Seven
usually,
Hills, like as a whole, does a lot of really cool stuff for people to help them really stay as independent as possible across the lifespan.
absolutely, absolutely. And even with individuals who are diagnosed with developmental disabilities, we have a whole different program for that.
Yeah.
So usually I recommend to connect with my supervisor who does self-directed supports for individuals with developmental disabilities.
Awesome. Do you for Seven Hills, do you work with individuals with mental illness, like severe persistent mental illness?
Yeah, so
Okay.
that sometimes is deemed as a disabling condition from a doctor's standpoint. So,
Yep.
really, if the doctor deems the level of care for an individual to be high or highest, which sounds like bogus words, but what it really means is that they require extra assistance around home
Yep.
and around personal care needs. So if that mental illness is also inhibiting those daily care needs and a doctor agrees with that, then absolutely they would be eligible for the program as well.
Wow. So from the independent provider program and the personal choice program to the programs for individuals with ID and SPMI, it sounds like you guys do a tremendous amount. Is it possible? And I'm just thinking, I know that there are older adults out there in the community who are also caring for their adult children with
Mm.
intellectual and developmental disabilities. If both the older adult and the younger adult need help, can they work? Can they both receive services from the same individual, or but maybe not exactly at the same time? But
Yeah,
okay.
yeah. So they can't so you're saying like a caretaker being the same person in the home?
Yeah, so maybe like the first 4 hours of the day are mom's hours, and the last 4 hours of the day are the child's hours, kind of thing. Is that allowed?
Yeah, so I know that there would have to be some like identification as far as the individual really making sure that those hours don't overlap so that no one gets in trouble with Medicaid fraud, you know?
Yeah,
Um,
exactly. One person can't provide hours for two people at the same time. That's kind of a double dipping thing, but
exactly.
yeah.
And also if the child is receiving developmental disability services and mom is receiving DHS services, that could be a conflict as well. So I would really just make a plan to outline those hours.
Yep.
But it definitely could be the same individual. Absolutely.
Awesome. Awesome. It just seems like there's so many opportunities for individuals to get the care that they need, but also to be able to be a caregiver and, receive some kind of repayment
Yeah.
for doing that. Amanda Hall Luther had a question. Is this program available nationwide?
Um, to be honest, I know that there are other types of programs in different states.
Mhm.
I would have to check into it more. I know yeah, to be honest, I do not know fully. I'm sorry. I don't
Okay.
fully know. Yeah.
Yeah. And other states, I think, might call it something different. That's
Yeah.
always possible.
Yeah.
So, with all the different services that Seven Hills offers, are you a for profit? Are you a nonprofit?
We're a nonprofit, government-funded agency. So um, a we have like a parent company called Hills Foundation. That's out of Worcester, Rhode Island. So the Seven Hills Foundation really does a slew of different programs. So at Seven Hills Foundation, they have behavioral health in New Bedford, developmental disability work in Rhode Island and Massachusetts. Um, They also have, I think, a clean needles program in New Bedford as well. They did like Puerto Rico outreach program. They have a Haitian program. So there's so many different programs at Seven Hills Foundation. Our affiliate, Seven Hills, Rhode Island, really takes care of adults and children and family services. So that's our main duty at Seven Hills, Rhode Island. And what we do here is work with individuals with developmental disabilities, aging adults. We also host different self-directed programs like My Choice, which is the developmental disability self-directed program. We also host Shared Living, which is another BHDDH funded program, and Right at Home, which is another DHS funded program where an individual can get a stipend for living with their older relative. So there's a slew of different programs at Seven Hills.
So it sounds like I
but
gotta
at the
have
end of
you
the day, we are a nonprofit.
It sounds like I have to have you back on for like the Right at Home program and the Shared Living program. Like,
Yes. I would probably reel in my coworkers for that one because unfortunately I'm not too familiar because the Right at Home program is very similar to Personal Choice and Independent Provider as far as eligibility process. So I definitely have to reel in my coworkers for that one.
that is awesome. So as a nonprofit doing some really cool stuff that is enabling people to stay independent across the lifespan, how can the viewers support Seven Hills? Is it best to say send in a check, make a donation, share this video, talk about the programs with the ones you love? Like, what would best serve Seven Hills?
I can't speak on the whole company's behalf, but personally, I find that just spreading the word is really important. And spreading the word about like the self-directed programs, I think is really important because I think that a lot of individuals ultimately choose these types of programs to have that kind of level of control in their life, and also as an alternative to, say, nursing home care. So I think it's really important to kind of spread the word out there. So I think the best is to share it with neighbors, share the video, those kind of things, because it's really a program at the state level that has been developed. And also Personal Choice is hosted by other agencies as well. There's 2 other agencies that work with Personal Choice. So I think just really spreading the word about self-directed supports in general is really important, because I don't know if everyone in the community knows that that's an option, you know?
Yeah. No, yeah, I think that's absolutely true. So everybody watching, you just heard it. Share this video. Really important. Hit the like button and share it. Doesn't matter if you're sharing it on your personal pages or the groups that you're in or the city or town pages that you might be a part of. Just share it, because there's so many more people I feel like could be helped by this program if they knew about it. That being the operative word.
Exactly.
So again, if people want to reach you, it is the 401-229-9700. There is no wrong prompt. They will get you.
Yes.
Awesome. So I'm really glad you took the time to come in today. And I want to have you or some of your coworkers on for the at-home program and the shared living program, because we really have to explore all these different alternatives to long-term care placement. It's so important.
Absolutely. Thank you so much for having me. I really appreciate getting the opportunity to spread the word as well.
Yes. Yeah. Thank you.
My pleasure.
This has been great.
Thank you so much.
Well, everybody, there is a wonderful opportunity for your loved one or yourself to get the care you need, and in some cases, get paid yourself or have a family member or a friend get paid to do the things that you need done. Also, a wonderful opportunity for culturally appropriate and language appropriate services. So I really encourage you to reach out to Seven Hills, reach out to Leanne. She's super sweet to talk to. She doesn't mind answering 1,000 questions. I asked her a lot of questions before we came on today so that I could understand the program better. She's an amazing woman. So don't hesitate to reach out. That's the 401-229-9700. The other fun thing that you have to remember is November 4th is the Virtual Senior Resource Fair. It's our second annual Virtual Senior Resource Fair. Very excited. We've got some amazing speakers, and it's going to be live streaming. So if you can see me now, you can watch the Virtual Senior Resource Fair. And it's not going to be possible without the support of our sponsors, because we are a nonprofit and every penny counts. So every donation people make counts for us. But when we're bringing these big events to folks, it's really important that we have our sponsors. So thank you to Commonwealth Care Alliance. They are our big sponsor for the Virtual Senior Resource Fair. CareLink, they were on a few weeks ago. They do some amazing work over at CareLink. And Oak Street Health. Oak Street Health, again, is one of our sponsors to do events as well as support all the other work that we do. So super grateful to Commonwealth Care Alliance, CareLink, and Oak Street Health. Set your calendars. Put it on your calendar. 9 a.m. November 4th. Join me right here. In the meantime, I look forward to seeing you all next week. Be well.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.